We've really changed our approach to deworming or internal parasite control in the horse, and that's why it's important to have your veterinarian part of this discussion. In the past, the normal approach to deworming your horse was to take all the horses on the property, whether you had 2 or 200, and deworm them at a regular interval throughout the year. And we've changed our approach. Now we're looking at more risk-based, or sometimes referred to as strategic deworming, where we're actually doing fecal egg counts on these horses. Not all horses carry the same worm burdens, and so we're not going to treat them all the same. And that's why it's important to have your veterinarian involved, because he or she, they're going to help you with those, get those fecals done for you, and then based on the fecal egg counts of these horses, they're going to lay out a program on how to deworm each horse individually. So if you've got 3 or 4 horses on your place, the chances are they're not all going to receive the same deworming program. The question of how frequent should we deworm the horse, there again, that kind of goes back to the old days where we used to deworm everyone the same at regular intervals, and that's not what we're recommending. So the interval is going to depend on the horse, and that's why these fecals, again, go back to these fecal egg counts, why they're so important. So if we've got some low-risk animals, we may only need to deworm them a couple of times a year. Once in the spring, once in the fall, with good, complete deworming products that get, a whole host of the parasites, as well as the encysted small strongyles. In the fall, we are always concerned about tapeworms and bots. So that's why it's important for the veterinarian to direct these programs, because they know which products will get which of the parasites and when the best time of the year is to administer those products. A fecal egg count, just very basically, we're just taking a sample of the horse's stool and we're doing what we call a quantitative fecal egg count. In other words, when we're done with this, we can tell you how many eggs per gram of parasite eggs there are in the stool of that horse. And again, this is important. Even though there's not a one-to-one correlation with respect to fecal egg count numbers and parasite burden in the adult horse, it's still the best live animal tool we have to decide how much worm burden this particular animal is carrying. And so based on that, we'll do these fecal egg counts, and depending on what that result is, then there again, that will dictate how aggressive a deworming program we're going to need to start for this particular animal. A fecal egg count reduction test is where we take an animal, we pull a sample and do a fecal egg count that day. The same day we pull that sample, we're going to administer a particular deworming product to that horse. And then we're going to wait approximately 2 weeks. That number's not set in stone, but about 10 days to 2 weeks. And then we're going to pull a second fecal sample and do another egg count on it. And between those 2 tests, we're looking at the reduction in the number of eggs. So that's where it gets the name fecal egg count reduction test. And so let's say that the first day that we did the fecal and administered the product, let's just say the horse had a fecal egg count of 1,000 eggs per gram. And then we wait about 12, 14 days and do another one. And let's say that fecal egg count now is down to 50. Well, we have significantly reduced the egg count in that horse, over 95% fecal egg count reduction in that particular animal. And that's good. That tells us then that the anthelmintic, or the dewormer, is still working properly. Now, when we do those fecal egg count reduction tests and we hit that about 80% reduction number or less, then we're concerned about egg resistance, parasite resistance to that particular product. And when we see that, then that tells us that we're probably going to need to pull that product out of our deworming regimen or program for that farm and go to another product. So the fecal egg count reduction test is really done to identify if a particular deworming product is still effective or not.